Good morning, everybody. Thanks for tuning into this morning's Process Automation webinar series. Philip Blanks, and I'm your host this morning. Reminder, this webinar series are only about 30 minutes long, so you'll be able to see a demo on how you can improve your business processes through our automation software, and then quickly get back to your busy schedules. So before we jump into the presentation, I want everyone is aware that the audio for the presentation is going to be broadcasted through your computer speakers. So if you experience any difficulties with your audio or video, send a quick chat to the host and I'll help you out. We'll have a Q&A session at the end of the presentation, so feel free to submit your questions at any time in the chat panel, which is going to be located to the right of your screen. If we are able to get to your question during the Q&A, we'll reach out to you afterwards to make sure that we can get your question answered. So go ahead and turn it over to our solution architect, Ryan Brown, so he can begin the presentation. Ryan?
Thanks for attending our May webinar. Today we'll be featuring a live demonstration of our electronic signature software with how to be used in your hospital. Today's presentation will first feature an overview of electronic signature. We also support integration into any of your hospital's HIS systems to launch our electronic signature software directly during the registration process. So it makes it real easy to use for your staff to continue to process your registrations like they do currently today, and then automatically launch our capture client to allow the patient to sign electronically. The majority of today's presentation will feature a live demonstration of our electronic signature software, using the signature pad, which is typically used at the registration desk, and then to demonstrate on my iPad, and we fully support other tablet devices as well, such as Androids, Microsoft Surface Pros, Lenovo tablets as well, and that's really handy for capturing those consents bedside for a patient. So rather than rolling the workstation on wheels into the room, you get the tablet into the patient's room, hand the tablet over to them, and they get signed electronically. Enables your hospital to streamline the registration process in other areas in the hospital, such as HR as well. Consents and other documents that are signed by our electronic signature software are then made immediately available to anyone in your hospital that has the appropriate permissions to view the forms. So, for example, if a patient was coming in for lab work, writing forms out on paper and having the patient carry the paper down to the lab department, or having an employee carry it down to the lab department, as soon as they sign documents electronically, give the signed consent forms and documents that they sign would be made available in your content management system, and labs or any other area in the hospital would be able to view them immediately. So it's really handy in that it makes any of the documentations with patient consents and signatures available instantaneously to anyone in the hospital that has permissions to view the documents. The electronic signature also allows your hospital to eliminate that unnecessary printing and scanning consent form. So, you're removing the paper from the hospital, eliminating the pre-printed forms, etc. So really reducing the costs and overhead of using paper in the hospital. Now, that's integration with electronic signature into the hospital. We fully integrate into any of the HIS systems. Scripps, Cerner, Epic, McKesson, Meditech, and many others. So the integration allows the software to launch directly during the registration process. So there's no need for your staff to log out of your HIS system and then log back into another system or start another system up. It's all automatic. They would process the registration in your HIS system. As soon as they're ready to capture the signature, the forms would pop up automatically and allow the patient to sign them. I'm going to show you today are just examples of how we could launch electronic signature from within a Meditech environment and also an Allscripts environment. We are also able to launch directly from Epic, Cerner, McKesson, and others, but I just didn't want to bore you guys and provide a bunch of different screenshots from every different type of system. If there's any questions on that, we could address those offline, do a one-on-one webinar where we talk about the HIS integration of our electronic signature software into your hospital. Here, it's the Meditech integration slide. You'll see that the registration clerk is able to process a new registration, and at the end of the registration, they'll see a pop-up window that says, do they want to gather signatures? As they click yes there, what would happen is Meditech would minimize, and then the capture client for Formfast would pop up automatically with all the patient's information, all the forms that they need to sign, and a registration clerk to fill out either the forms electronically and have the patient sign them. Just an all scripts integration slide. Very similar. They would process the registration, and then they could go up to their tools menu, and they'll have an option at the bottom that says Forms Electronic Signature, and they could click on that, and that'll pop up any of the forms that are relevant to the patient, and allow the patient to sign them electronically. Electronic Signature capture software, it's all launched using a dynamic URL into our API. So what that means is it makes it really simple for any of the HIS systems or our portals as well to launch our capture client directly. So you embed a dynamic URL into different applications, and we could pass it, the login credentials of who's logged into your HIS system, pass the pay information and the type of forms that they need to sign as well, so that all the correct forms are launched automatically. There's no need for anyone at the registration side to go in and select any forms. The job packets come out automatic, and all the registration desk has to do is fill out the form electronically and then have the patient sign it. So we're into the live demonstration of electronic signature with the computer version using Signature Pad on my workstation to sign the documents electronically. So what I'm about to show you would be the process that a typical registration desk would use when they're processing a new registration. So they would process the registration in their HIS system, for example, a Meditech, and when they come to the window that says, do they want to gather signatures, they click on yes. What will happen is software will automatically load up. The HIS system will minimize, the capture client will load, and the registration desk and the patient will be able to see all the forms that are relevant for them and fill them out electronically. Today is a 2-page form that the registration desk could work on. Both pages here, the thumbnails on the left-hand side, and we color code each form just to give a high-level representation of what's required. Indicates that there's some optional information that may or may not be filled out on the form, and a red dot indicates that there's some required information that the registration desk must fill out before they try to archive the form into content management. This gives you guys the ability to capture that signature electronically, and then by clicking the archive button at the bottom here, send the form directly back to content management. And you support Meditech scanning and archiving, OnBase, Perceptive, and pretty much any type of content management system out there. So like I said, it completely eliminates having to print the form and then sending it down to HIM to scan it back in. It's all immediately, and it completely eliminates the paper. You'll see here, the view that you're looking at right now is the view that the registration desk would look at, where they could see all the options to sign a document. They could also print it if the patient does ask for a copy, archive it, and individual thumbnails. But we launch a secondary view as well, which is a little more restricted, and it really just shows the form surface, and also gives the patient the ability to zoom in. And what this display is used for, it's for that secondary patient-facing monitor, which is the best practice, but it is not required. But it allows the patient to see the form in real time on their monitor as the registration desk works on it. So you don't have any of the options to print the form, delete the form, archive it, etc. But it does give them the ability to see the data that's being entered by the registration desk, and most importantly, when they sign the document, they could see their signature appear on the screen in real time so that they know where it's going. Let's switch back here to the view that the registration desk would have. And I'm over here to my second page that has a required element. So as I look at the document, I get different elements that I defined on my registration form. The blue fields are optional pieces of information, and anything that's highlighted in red is a required element that must be filled out. Now, registration, this is just an example form, but we are able to take any of your hospital's existing registration and consent forms and load them into our system so they'll be identical to what you're using today. And to pick and choose which elements should be optional and which ones are required. So I could have made every element on this page required, but for demonstration purposes, I just wanted to make one element required. It's really nice that you can pick and choose and make sure that any check boxes, signature boxes, fillable text fields, etc., that you want to make required are filled out by your staff before it gets sent over to content management. Now you'll see that I'm automatically merging all the patient information onto the form from HIS system. And when I go to fill out the form, it's very simple. As the registration desk all they have to do is click on the field and they can begin typing. So for example, the minor consent form, I could type my name, Ryan Brown, and the field will change from a blue to a green just to indicate that information has been captured. Consent form, I'm going to come down here. I could list Philip as the witness, and I'll use the checkbox that patient is a minor and that our representative will sign on their behalf. Now, boxes work the same way. As I select different checkboxes, you'll notice that they are highlighted in green as well, just to indicate that they have been selected. Once the information that I need to capture, I'm ready to sign the document electronically. So what I could do is come up here and click the sign icon next to my signature pad. So I'll sign, and what I'll do is sign my name. And you'll notice that my signature will appear on the screen in real time. I accept the signature, two different things happen. The notice is we are automatically inserting the date and timestamp of when the signature was captured. So prompting the user, we're able to look at the server time and automatically insert that date and timestamp onto the document. And that's configurable. You could turn it on and off, and you could also choose the location on where you would like that to appear. The other, once we capture that first signature, is we lock down the document. So you notice that those fillable text fields that I previously filled out for the responsible party, the witness, and the checkboxes are and are unable to be changed. Once we capture that first signature, we lock down the entire document just to prevent any changes from being made. If you need to make a correction, if a mistake was made, what you could do is right-click on that page of the form and choose to clear the form, and that will erase the signature and the data that was entered and allow you to change it on that one individual page. The signature, since it's already signed into your HIS system, no matter if it's Meditech, McKesson, Cerner, etc., rather than using the same signature pad that the patient used, they could just very simply right-click on the field and choose to self-sign the document. And we'll have to see who's signed into the system, and we could say that the document was self-signed by Ryan Brown and insert the date and timestamp. And I have two different examples of the date and timestamp here, that we place it on the same line as the name, or place it above as well. The feature is really nice in that, the registration desk or any of the nurses, etc., can just self-sign the documents rather than using the signature pad. If they capture a wet signature, they can use the signature pad, but this digital signature using the self-signing feature is legally binding and enforceable in court. So we find that most hospitals do that. It provides a nice legible signature, and it's really easy to use. Notice that once I captured that one element that I had on my page, that the red dot over on the left-hand side changed to a blue just to indicate that there are no required elements left. There's no element my witness signature. So I fill in Philip's name real quick. And for his signature, the dot will change from a blue to a green to indicate that everything has been filled out and the form's ready for archiving. So if the patient asks for a copy, I could click on print and give them a printed copy, but if they do not need a copy, I could just very quickly click on archive, and this will send the form over to my content management system, and it would be viewable under the patient health record, available anywhere in the hospital. I'm going to switch over to my iPad just to show you guys how the tablet version works with electronic signature. We do support multiple tablet devices, Android devices, iPad devices, Microsoft Surface Pro, etc. As they have an HTML5 browser, so pretty much as long as the tablet was made in the last couple of years, you should be good with using that tablet with our Formfast Capture client software. Electronic signature on an iPad is slightly different than the computer version. You'll be doing is rather than display each individual page on the left-hand side, we combine all the forms into one single document. Bedside consent, where you would use a tablet device. You would launch the form and then hand the tablet over to the patient. So to make it really simple for them, rather than trying to train them on using the system, all they would have to do is scroll through the document. So they could scroll through the first page and display the second page after that. So they could continue to scroll through the document to see all the pages and areas that they need to fill out. So it makes it very simple for them to use. Now, what you're using, we support different features such as rotating the screen. So if I horizontally, you'll see that it updates in real time. I just spread my fingers if you're familiar with iOS to zoom, or pull my together to shrink the text as well. So the features with rotating the screen and zooming in and out is all fully dependent upon the hardware, the tablet devices that you're using, and not the Formfast software. We do incorporate those features into the software if your hardware supports it. To fill out these fillable fields, very simple. I'll scroll down to that second page again here. The responsible party, I could just click the field and begin typing. I can type my name here. Different checkboxes down below. Signature, same thing. I can just click on the signature field, and you'll notice my signature window pops up, and I could write my name. We'll signature to the document here. And like the computer version of electronic signature, we lock down the form and prevent any changes from being made to the fillable text boxes and the text boxes that I previously selected. So it was made very simple. All you would have to do is come up to the Formfast eSig drop down at the top here. I could click on that drop down arrow and the ability to clear the form. For the patient, I could just click on the print button at the top, but if everything looks good, I could click on done, and that will send the form directly over to your content management system automatically as well. So here on a tablet device is just another way to interact with our system. You're able to use different hardware at different areas in the hospital with electronic signature. So typically a registration desk, they're using the signature pads that you would find at grocery stores or department stores. Side consents, they may use a signature pad on a workstation on wheels, or some hospitals and ERs are using the tablet devices just to count as bedside consents, very simply, rather than rolling the workstation on wheels into the patient room. So I'm going to turn this back over to Philip, and we can answer any questions that you guys may have.
Okay, Brian. A few questions that came in. First question was, is there a preferred option for an eSignature solution? Hardware option.
So on the hardware option, typically we see a lot of success with the Topaz USB signature pads that are being used at the registration desk. Most of the hospitals that we've implemented eSignature at are using the Topaz devices. That's typically what we recommend. They could be used for other applications outside of Formfast electronic signature as well. It's nice that you're not just buying one piece of hardware specifically for Formfast. You could use it for other applications in the hospital. Prices for those signature pads, they vary, but they range from about $80 each to a couple $100, depending on the features that you want to have on the signature pad, such as backlighting, if you want it to be a Bluetooth one or a USB cable, etc. Sense, you know, we can pretty much support any type of tablet device as long as it has an HTML5 browser. So I typically use my iPad, but we also have hospitals using Microsoft Surface Pros, Android tablet devices, Windows tablets, etc.
Okay. Next question. Do you have the option to automatically migrate the patient's name onto the form instead of having to manually type it in?
So, let's see. But I'll do the screen again real quick. My screen right now, is it still sharing?
Uh, policy.
problem. I'm able to do that. So I pointed out at the bottom of the document where we automatically copied over all the patient information, their demographics, name, medical record number, account number, physician, date of birth, admission date, etc., onto the form. We'll merge that information anywhere onto the form. So we could definitely automatically merge the patient name and that patient information that's coming across through the HL7 ADT admission record onto the form surfaces rather than type it out. Demonstration, I just wanted to highlight some of the features that we support in eSig, how we do have those fillable text fields, but we can definitely merge that information along dates and timestamps of when it comes out of your HIS to the form surfaces automatically.
Okay. Is there an option to email the consent form directly to patient after signing?
This time, there is not an option to directly email out of our application, and we do that for security reasons and HIPAA reasons, just to make sure, it's encrypted. You do have the ability to print it as a PDF file, and then you could manually email it to the patient if you want to, encrypt the email first. Email directly from our application is not supported.
Okay. And do you have any customers using tablets in patient areas or ER areas?
Customers using tablets in the ER areas. We have some that are using them at the registration desks as well, but typically what we see is the registration desks are using the signature pads. It just allows the staff, the registration desk to operate a little more efficiently because they're dealing with a larger number of forms. So they prefer typing on a regular keyboard rather than a tablet device. We are fully supported in using the tablets at the registration desk, but we typically see the preference at registration is to use the pad and a real keyboard just to make it a little quicker for them.
Okay. Get one more question. Can the signed form be archived to more than one system application?
And so the way the signed documents work, we export the complete documents as a TIFF image file, and we'll include a metadata file that identifies the document. So the metadata file will include, for example, the patient name, their medical record number, account number, the type of document, if it's a consent form, a registration form, etc. And basically, any type of content management system out there is able to read that directory and import it. So we're able to, write that data out to the Formfast server, and then you could have different systems read from that directory and import it into different locations. So you can import it automatically into your clinical system, and then if it's an HR form, if you want to send it over to a Windows file server that HR is using, etc., you could do it as well.